ICU when ICU was on the first floor. Does anybody know what's in the old ICU now? Dialysis. I graduated from Stockton with a BSN. I was the director of the orthopedic unit, 3E, where are you? I went down to nursing administration for a while, was the administrative director under Maureen Schneider. Then I went back to staff nursing, went back to orthopedics, went back to ICU, which is now on 2F, then came to my current position, which is a clinical nurse educator in the education department. Where's the educators? So that's my career, blah, blah, blah. So then I had the opportunity to attend a convention. I went to the National League for Nursing in New Jersey's convention. Their theme centered on self-care, professional fulfillment, caring for the nurse within. Coincidentally, everyone should know that the American Nurses Association has dedicated this year as the Healthy Nurse. And their Nurses Week theme, of course, everyone should know, is nursing the balance of body, mind, and spirit. So, is anybody stressed at work? Has the Joint Commission done you in yet? You got one more day to do you in. Now, what does RACE stand for? IPOC, IPOC, IPOC. Who's got an IPOC? Is that a call bell? Is that a bed alarm? Is that an IV alarm? Is that a cardiac alarm? Are you stressed at home? Kids going off to college? You're in college? Can you afford both of you in college? Are you experiencing a little empty nest? Younger nurses, do you think this is not what you signed up for? Do you have enough education? Are you an associate degree nurse from Ocean County College? All right, you better look to be going beyond that associate degree. Do you need to go back to school if you're 55? I am in a doctoral program, I'm 62. You can go back to school at 55. How many of you toss and turn at night? How many of you check your fitness watch to see how well you sleep? Do you feel drained even before you go to work? Do you find yourself talking about the people you work with? Lashing out at your colleagues, calling the doctor's names under your breath, or maybe out loud? Do you get sick easily? I had to call out, I need a mental health day. Do you have headaches? Do you have stomach pain? Do you cry if a doctor looks at you cross-eyed? Do you think you're overly criticized or underappreciated? But all these things are very common, especially in healthcare and really with society in general. Nurses are often asked to do more with less. Our patients are sicker. Our patients demand more of our time and more of our energy. Our patients' families are overly stressed, overly frustrated, and sometimes they take those frustrations out on us. But we need, as nurses need to continue to offer the best care that we can. We need to take a nice, where are my postpartum labor and delivery nurses? We need to take a nice cleansing breath. Every once in a while, probably every 5 minutes. Now remember, the focus of healthcare is patient satisfaction, improving population health, high quality indicators, and cost containment. Now we have a couple of administrators in the room, and they're well versed in this. They call it the triple aim. improve that patient experience, improve the population health of those that we serve in the community, and reduce the cost of those patients. But who is the one group that's going to ensure that that all gets done? The nurse. And I was at the award ceremony on Monday, and I truly mean this. There would not be a community medical center or any other healthcare institution without the nurses. You can have, and you know, I know there might be some ancillary departments here. You can have a lovely lab, a lovely radiology suite, radiation therapy, but it's the nurses that drive healthcare in the United States today. Remember, we are the most trusted profession, ranked #1 by the Gallup poll for almost every year, probably over 40 years now, except in 2001. And that was the first responders. But ladies and gentlemen, nurses are also first responders. Constant change and many frustrations are the reality of healthcare. We can either work within the system or leave and bag groceries. Sad to say, too many of us are leaving, not able to cope and choose to leave. Too many of us have what we used to call burnout in the old days, which now has a nice, softer term, compassion fatigue. Let that not happen to us here. But what can we do? We need to take care of ourselves first. When that airplane starts to go down and that oxygen mask falls down, where does it go? It goes on you first. So nurses, when you're having an emergency, you take care of yourself first so that you can take the best care of your patients. So here are some of the things that we can do. We are going to attend the Community Medical Center Gala every year. We are going to participate actively in committees and activities at Community Medical Center. We're going to do something just for us. We're going to go to the movies. We're going to take walks on the beach. We're going to get massages. We're going to go to the spa. We're going to have alternative therapies. We're going to get acupuncture, acupressure, Reiki, whatever is the latest thing out there. We're going to read a trashy novel. We're going to read a funny novel. We're going to watch YouTube Z-Dog MD videos. And if you don't know who he is, go check him out. We're going to leave work at work and not bring it home. We're going to take a cooking class. We're going to pay it forward. And what I mean by paying forward, I had a little incident that occurred to me about 6 weeks ago. I'm in the Dunkin' Donuts line, if anybody's ever been in a line for the drive-thru. It can be quite long, and getting very frustrated, waiting for this line to move. And there was this big Escalade in front of me, and he's taking his time, and I'm like, under my breath, cursing him out. I move up to the window, the woman says to me, the guy in the van in front of you just paid for your coffee. Now, I could have kicked myself for that, but this is what I mean by pay it forward. So I have done that and paid for someone else's meal. So if you think that this is too much for you, certainly you can go to a professional. We have lots of nurses that are professionals in healthcare and mental health. So if you think you're a little bit more frustrated or more stressed, certainly seek that person out. But what can you do for some of your colleagues that might be a little stressed out? You know, we all have bad days. And sometimes someone's assignment's a little worse than yours. Go over there and help them out. Even if you don't like them, go over and help them out. When anybody does a good job, tell them, you did a great job. Just that little bit of praise goes a long way. Always take breaks. Always go to lunch or dinner. And when you do take a break and you do go to dinner, take someone with you. Take your colleagues to the nursing week festivities. Nominate them for award. How many awards do we see? Employee of the Year. Have a nurse of the shift. Give them an award. Celebrate birthdays, getting degrees, getting certified, family weddings, family births, family graduations. Bring a cake to work. You know, we all look for those sales in the lobby, all those cakes. Nothing better than a homemade cake, right? Take the group out for breakfast or dinner after a tough shift. Get up off your chairs. Get away from your wows. Play a little music, very low, maybe in the break room. Do a little exercise. Research has shown that exercise, dancing, and sports produce endorphins that reduce stress and elevate your mood. So I want you to take a challenge. I want you to list 3 things that you're looking forward to do during your life. What's on your bucket list? Think about what or who you are proud of. Is it your daughter? Is it your mom? Is it your dad? Send a text to someone and tell them that you are grateful that they are in your life. And every day, at the end of the day, list 3 things that you are thankful for. And I ask that you, to paraphrase Gandhi, be the change in the world that you would like to see. And I want you to be happy. Everybody stand up.